Muscles of the head. First one, muscle of the skull. This one is occipitofrontalis. This is frontal part. Frontal part originate from the skin and superficial fascia of the eyebrow and is inserted into the epineurosis. Then this one is occipital part. Occipital part originate from the occipital mustard process and the lateral part of the superior nuchal line, and it is also inserted in the epineurosis. But इसका function है, it form wrinkle of the forehead and this wrinkle of the forehead and raises the eyebrows, and this one ये this pull back the scalp. फिर उसके बाद है मसल्स ऑफ द फेशियल एक्सप्रेशन. उसमें फर्स्ट पहले जो है वो आई की मसल दे. आई की मसल, दिस वन इज ऑर्बिकुलरिस ओकुलाई. ऑर्बिकुलरिस, दिस one is palpebral part and this is orbital part. Palpebral part originate from the lateral part of the medial palpebral ligament and insert into a lateral palpebral raphe. It closes the eye during sleeping or blinking, and it also opens the lacrimal gland. Lacrimal groove, sorry, not lacrimal gland, lacrimal groove. फिर उसके बाद है orbital part. This is orbital part. Orbital part originate from the medial part of the lateral palpebral ligament, and it encircle the eye and insert the whole eye. इसका function ये it forcefully closes the eye. फिर इसके बाद second one है corrugator supercilii. This is corrugator supercilii. Corrugator supercilii originate from the medial part of the superciliary arch and inserted into the eyebrow behind the frontal belly of the occipitofrontalis muscle. It forms the vertical wrinkle of the forehead. फिर उसके बाद है nasal muscles. Nasal muscles में से पहला है nasalis. Nasalis के दो पार्ट्स, एक ट्रांसवर्स पार्ट उसको कंप्रेसर नेजी कहते हैं, एक डायलेटर पार्ट एलर पार्ट उसको एलर पार्ट भी कहते हैं. इसका जो ये nasalis पार्ट, ये compressor nasi originate from the frontal part of the maxilla, frontal, and inserted into this ridge, this epineurosis, and both the side combine to join together at this epineurosis. Then उसके बाद यहाँ पे एक और है, उसे कहते हैं dilator nasi. और एलर पार्ट originate from the maxilla, inferior and medial to the compressor part and inserted into the elar. It helps to dilate the nostrils. फिर उसके बाद है depressive septi. Depressive septi originate here from upper part of from the maxilla above the incisor bone and inserted into the septum. It also helps the dilator muscle to dilate the nostrils. फिर उसके बाद है muscles of the lips. Muscles of the lips, the first one is this one lip. This is orbicularis oculi. Orbicularis. This is orbicularis oris. Orbicularis oris originate from the maxilla, mandible, and skin of the lips and inserted into the mucous membrane of the lips. It closes the only muscle जो lips को close करते हैं. फिर इसके बाद है muscles of the lips जो lips को खोलते हैं. इसमें first this one is levator levi superior iliac nasi. This originate from the frontal process of maxilla, और insert होता है upper lip. Insert होता है elar part of the nose and upper lip. So its function is to open the nostrils and pull the upper lip upward. उसके बाद है levator levi superioris. This is levator levi superioris originate from the maxilla below the infratemporal foramen and inserted into the skin of at the corner of the lip. It raises the upper lip upward. फिर उसके बाद है this one is zygomaticus minor and this one is zygomaticus major. Zygomaticus minor originate from anterior part of the lateral surface of zygomatic bone, and this major originate from the posterior part of lateral surface of zygomatic bone. This inserted into the zygomaticus minor inserted into the upper lip, and the major inserted into the skin of the corner of the upper lip of corner of the mouth. Both function of both is move the upper lip upward and laterally. फिर उसके बाद this one is buccinator muscle. We will talk about later on about this later on. फिर this one is rhizoris originate from the this is actually the masseter muscle. So rhizoris originate from the fascia on the masseter muscle. Then inserted into the skin on the angle of mouth. This is the only muscle that retract the angle of mouth. फिर उसके पास this is depressor angulioris originate from the oblique line on the mandible below the canine. यहाँ पे molar, premolar and first molar teeth and inserted into lower lip. उसके बाद फिर है depressor labii inferioris. Depressor labii inferioris from anterior part of the oblique line on the mandible and inserted into the lower lip. Both these muscles pull the lower lip downward and laterally. तो इसके बाद है mentalis originate from the mandible below the incisor bone and inserted into the chin. The function of this muscle is to move forward and protract the lower lip and also form wrinkle on the chin. This one is buccinator muscle. Buccinator muscle originates from the outer part of the alveolar part of the maxilla and mandible opposite to the molar teeth, premolar teeth, and also originate from the pterygopalatine ligament and inserted when it reaches the angle of mouth. It is divided into three bands: anterior, superior, middle, and inferior. The middle one again is divided into three bands. The lower band move upward and inserted into upper lip. The upper band and move downward, inserted into a lower lip, and the central one is attached to inserted into the angle of mouth. Then the upper lip or upper band of this masseter muscle, buccinator muscle, move to upper lip, and the main lower band inserted into the lower lip. This is the parotid gland duct or Stenson duct which pierces this one. This is the buccinator muscle which pierces this buccinator muscle.